Hello, my name is Heather, and I'm a registered nurse. I'd like to welcome you to Adult Type 2 video series. And in this video, we're going to talk about staying healthy reminders. Just a few reminders as you watch this video series. We encourage you to watch the videos in order. And just remember, you can go back and watch the videos as often as you'd like. Fraser Health on the Road to Diabetes Health is a great resource to accompany this video series. And remember, you can pause the video at any time if you would like to spend a little bit more time reviewing the information. We would like to acknowledge that our work occurs on the beautiful, traditional, ancestral, and unceded territories of the First Nations of the interior region. We also recognize the Métis Nation and the contributions of the Métis peoples to the Indigenous ways of being and knowing on this land. We're going to review lifestyle management, monitoring, regular examinations, laboratory monitoring, and vaccinations. Let's start with reviewing lifestyle management. Quit smoking, managing your stress, taking your medications as prescribed, daily foot care, reaching your recommended physical activity targets, and finally, planning balanced meals that keep your blood sugars stable. Next, let's look at monitoring reminders. These include blood pressure with a target of less than 130/80. You also would want to avoid excess body weight, particularly weight carried around your middle or waist. So that would be measured by waist circumference with a goal for men to be 40 inches or less, or 102 centimeters, and for women, less than 35 inches or 88 centimeters. And finally, blood sugars are stable and in the recommended target ranges suggested for you. In addition to some of the regular visits you'll have with your healthcare team, there are some other regular examinations that should be occurring when you have diabetes. It is suggested that you have a dental exam every 6 to 12 months, that you have your feet examined by a health practitioner at least every year, and that you have your eye doctor provide a dilated eye exam every 1 to 2 years. It is recommended that some regular laboratory monitoring occurs, that approximately every 3 months you have an A1C done. Once a year, you have your cholesterol tested, as well as your kidney function, and once a year, you have your meter checked to ensure accuracy compared to the lab. And finally, vaccinations. As part of staying healthy reminders, it's recommended to have the flu vaccine each year. We also recommend that you speak to your healthcare provider about the pneumonia vaccine or any other vaccinations that may be recommended for you. Thank you for watching Staying Healthy Reminders video. This is the final video in the Interior Health Adult Type 2 video series. If you have questions, speak with your family doctor or nurse practitioner, or call the Diabetes Center and ask to register for a Type 2 diabetes question and answer session. We'd like to thank you for viewing the series and remind you that you can return and watch these videos as often as you'd like for information about living well with Type 2 diabetes.